for asking me to spend some time with you all this morning. I'm really honored to be here. It's nothing for me to kind of take time. I'm so happy to be here, and the fact that I have a little more time than usual in my day to be here with you because we're on vacation is great, and that's actually how much the program here at the Ronald McDonald House means to us and our families. Michael's always asking us, what can we do for you? Your staff is always asking us, how can we help? And we are very happy to be on the other side and say, what can we do for you? So this is a little piece of what we can do for you, and so I'm here. I'm the Pediatric Director of the Hasbro Partial Program, as Michael mentioned. For those of you who aren't familiar with our program, we are a med-psych day treatment program for children and adolescents and their families who are struggling with medical and psychological challenges. We have a partial level of care, and right now we service 24 families at a time. And we've been lucky enough through the help of Hasbro, and of course the support we get here from Ronald McDonald House to have recently expanded. We also have a whole continuum of care that includes an inpatient med-psych unit as well, and outpatient integrated med-psych services. And we feel really proud and humbled to be the only program of our kind in the nation, actually, and we feel so lucky to be able to provide this kind of care. At the core of what we do, our philosophy and practice, is integrated, meaning we put it all together. We don't like to treat people in silos. Integrated in terms of medical issues, in terms of emotional challenges, in terms of providers that people have in the community, in terms of providers that in the hospital, and ourselves, schools, every important piece of kids and families' lives we really know is important in terms of recovery and getting them to a place where they can thrive. And so when we talk about integrated, we're really talking about that. And honestly, having Ronald McDonald House here is such an imperative piece of that integration. We don't take that for granted at all. We're also patient and family centered. Again, that's an essential tenet of what we do. It's about partnerships with families, and obviously we couldn't have families here engaging in our program that don't live nearby unless we had the services of Ronald McDonald House. So again, we thank you. So over the years, we've grown, as I mentioned. We now serve 24 patients and families at a time. We do run a wait list. Thankfully, our wait list has been reduced because of our expansion. And our wait list for people coming kind of from out of region has also been reduced because of the services around here and the fact that as Ronald McDonald House expands, we'll be able to accommodate even more folks who are coming from out of region so that they it's not prohibitive for them to come and stay. Our model in the partial program, albeit pretty cliche, is that it takes a village. And we know that our partnership with each family and our journey as a program, as well as our whole care continuum, are only possible because we have the support of our own village. And we really, our strong partnerships, significantly our partnership with Ronald McDonald House is really how we have been able to grow and thrive. I can really say that unequivocally the Ronald McDonald House staff and program in general, and really the amazing people that are at the heart and soul of it, all of you, have been invaluable in terms of our journey as a program, but more importantly, in supporting our patients and families on all of their own journeys. And really, there are so many families that would not be able to engage in our program and in the work that we do and partner with us if you didn't exist. So as I think about Ronald McDonald House and the tremendous impact that you have on the community, I think about the elements that makes you so effective in what you do. And one of the things that comes to mind is, again, everyone's always asking, what can we do to help? How can we work together? Not only, again, for the patients and families, but for us as well. You provide so much more than a place to stay. And I'm sure you'll hear about that a little bit more, but you're really such an essential continuum and continuity of support for families who are often going through some of the most difficult times in their lives. So, the house itself is so important, but the heart and soul that is really Ronald McDonald House is what's so important. We first met with Michael a couple, maybe more 3 or 4 years ago, when all this expansion stuff was in its early phases. And not surprisingly, there he was doing his needs assessment, saying, what do you need? How can we help? How can we best work together? And that's always really the theme in terms of our partnership is how can we work together? And again, that's so helpful. And I must say, in the world of healthcare, that is such a welcome change. So usually I'm talking to an insurance company and they're not saying to me, how can I help you? So, you know, our program is sometimes really hard for people to understand. A lot of people don't get it. You know, we're a partial program. What does that mean? We're integrated. What does that mean? We're patient and family centered. What does that mean? So when we're working with the staff and with everyone here around the Donald House, we never feel like we have to explain ourselves, and that's really helpful. And your willingness to think out of the box in so many ways has really been invaluable. So you mentioned you know, there are a lot of patients, none of our patients who come to our program, obviously on the inpatient unit this isn't the case, but none of them stay overnight. So you know, the day usage that Michael's referring to is so very important for our families. Because again, we do have patients who are coming from all over New England, some of whom are able to commute home in the evening and they may prefer to do so in order to kind of engage and get the support of their own families in the evenings on the weekends. But when I asked a few of those families, you know, what does it mean for you to have Ronald McDonald House? They say, well, we couldn't do it without it. And you know, we're getting our son back. When family said to me, we're getting our son back, he's getting his life back, we're getting our lives back, and we wouldn't have been able to do it without you, but without Ronald McDonald House. So that's really the impact that the work here has for us. As you all are moving forward towards the final stages of your expansion, which is so exciting, you're enabling, you know, it's going to enable you to support even more families in supporting their children. I'm here on behalf of all of our Hasbro partial team and their families, and all of our families that we work with, to say thank you. And we thank you for being such an important part of our village. We thank you for all you do for Hasbro, for Rhode Island Hospital, Women and Infants, and beyond. We thank you for making so many journeys for families and children towards health and healing possible. And please know that we are always here wondering, what can we do to help you? So thank you so much for being such an important part of our village.
Thank you very much.